This Focus on Health segment is brought to you by Aurora Healthcare.
Hi everyone, I'm Connie Carmical and welcome back to Oshkosh Today. Today, many forms of healing arts are used here at Aurora Medical Center Oshkosh, and not all center around what many describe as conventional medicine, or what you may think of as surgery or taking prescription medicine to help heal. On today's Focus on Health, we put the spotlight on acupuncture. This approach to healthcare and wellness isn't really new. It's been practiced for thousands of years with good results. Acupuncture is an option right here at Aurora Medical Center Oshkosh, and Dr. Robert Holly is an OB/GYN and trained and certified medical acupuncturist. We are now here with Dr. Bob Holly. Thank you so much for joining us.
Thank you for having me.
Well, today's focus is acupuncture. Why don't you tell us a little bit about what is acupuncture?
Acupuncture is a discipline of Chinese medicine where we use very fine needles to stimulate what is called qi. It is an energy force that is flowing throughout our body. And we use certain points along what are called meridians to reestablish this flow of energy.
Now tell us a little bit how this works.
Well, as we understand Western medicine, it's difficult to explain how acupuncture works. In Chinese medicine, like I said, we have this energy force flowing through our body, and it's when it gets blocked that we have pain, disease, and illnesses. So we use the needles to reestablish this flow of energy so that it allows the body and stimulates the body to heal itself.
Now, I noticed you have one of the needles with you. Can you show our audience a little bit about this?
It's a very fine needle. It's much finer than even the needle that diabetics use to inject insulin. And again, it is inserted at these certain points, and the model behind us shows where the points are. And because of the fine nature of the needles, there really is no pain associated with it. That is probably the biggest question that I get asked, does it hurt? Mm-hmm. And the answer is no. There is a sensation with it, but there is no pain.
Now, how many do you use at a time, or does it depend on the condition?
It very much depends upon the condition and also the philosophy of the treatment. We can use needles, a low number of needles to treat the conditions, or some philosophies, they'll use up to 100 needles to treat a condition.
Oh my. Well, let's talk about a little bit about what types of conditions do you treat?
The biggest reason that I do acupuncture is to treat pain, from back pain, which I see a lot of. It is approved for osteoarthritis, particularly of the knee. We can treat infertility. I can turn a breech presentation to a vertex presentation. We can induce labor. We treat nausea, vomiting, not only with pregnancy, but also associated with surgery.
Now, is this something that you have to come back in every so often, or does this a one-time only cure, or how does acupuncture work in that way?
Primarily, it's a treatment regimen, and the rule of thumb is the longer a condition has been present, the longer the treatment sessions will take. It's not uncommon in the literature to read that some of these treatments are like 20 to 30 sessions long.
Okay. I'm just curious, do people, besides pain and everything, do patients use this for any other thing, like quitting smoking or diet?
In answer to your question, yes. Like I said before, we have the other treatments, like for the breaches and labor, and we do have an indication for weight loss and for smoking cessation. And in fact, when we do that, we have the patients wear what is called an ear tack, and it's a very tiny needle that they wear on their ear.
Oh my.
And depending on the patient's commitment to either stop smoking or lose weight, it can be a very nice help.
This is quite fascinating. Is there any side effects to something like this?
Well, there are, but those side effects are very minimal because of the size of the needle. If we hit a blood vessel, we get maybe a drop of blood. We use single-use, sterile, disposable needles, so there really is minimal risk for infection. Because they are single-use, we don't worry about AIDS or hepatitis. Injury to organs, if an acupuncture needle was inserted too deep, it could certainly cause like a pneumothorax or around the lungs. Certainly if acupuncture is done around the eye, there are potential, but just being careful.
Sure. There
are minimal risks. One of the major side effects that I tell people about is people tend to get very sedated. Mm-hmm. And most of our acupuncture treatments are done lying down, and a lot of people just fall asleep.
Well, like you said, I'm sure a lot of people are surprised that you said there's really no pain at all with it, and they're surprised at the size of the needle. And
it is, and they're I think as much surprised by how effective mm-hmm. it is.
Well, it's just another option. It's a great another option for people to check out.
Exactly.
Well, thank you very much.
Thank you.
And if you'd like more information on acupuncture, you can always go to Aurora's website at aurorahealthcare.org, or you can call the Aurora office at 303-8700. There are many forms of complementary medicine here at Aurora, including massage therapy, pet therapy, aromatherapy, and a host of others. In conjunction with Conventional Medicine Review, Aurora Complementary Medicine focuses on integration of all types of medicine to enhance patients' healing and health. For more information about acupuncture, call Dr. Holly's office at 920-303-8700. For more information on all the complementary medicine programs Aurora has to offer, you can log on to the website at aurorahealthcare.org and click on Health Info. I'm Connie Carmical, and thanks for joining us on this Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.